Good afternoon and welcome to the local Blackhawk County Emergency Management and Emergency Operations Center COVID-19 press briefing for today, May 7th. Today's press briefing is being offered by our media partners and to our media partners via Zoom, as well as via Facebook Live. This is an attempt to encourage social distancing, improve our communications and reach, and better keep our media partners safe during the COVID-19 surge. For the media who are joining us via Zoom, all participants will be muted during the entry to the meeting. You will have the opportunity to ask questions after the speakers have completed speaking. If you are on computer, we ask that you raise your hand in quotes or put your questions into the chat box. We do have moderators here that will facilitate that for you. Dial-in partners need to press *9 to raise your hand, and you will be given the opportunity to ask questions as well. We will try to address all questions. However, if your questions do not get asked at the time that I close the press conference, they will be forwarded to the appropriate person and an answer will be sent to you as soon as possible. With that being our introduction, today's press conference is an exciting one because we've been working diligently with our community partners and business partners, Tyson Incorporated, Tyson Fresh Meats. And today we have the pleasure of bringing on board both local and corporate spokespersons to talk about what's been going on with their plant. But as usual, my first introduction is our Incident Commander and Director of Public Health here in Blackhawk County, Dr. Nafissa Cisse-Egbuonye.
Good afternoon, everyone. I want to start off by thanking the community for their continued support and donations and morale-boosting foods such as cookies and messages that we continue to receive. To the health department staff and healthcare workers, thank you very much for all your hard work. Sheriff Thompson and the EOC personnel, thank you for running this marathon with us. As of Thursday at 12:30 p.m., there is a total of 1,703 reported cases. Our total death count is totaled to be at 21 today. Of the cases, we have 742 people recovered, and a total of 80 individuals have been hospitalized. A total of 5,195 Blackhawk County residents have been tested for COVID-19. In addition, ethnic minorities make up 16% of the population in Blackhawk County. However, 5% are impacted by COVID-19 in comparison to whites at only 0.8%, which make up 84% of the population. I highlight this because the beauty of Blackhawk County lies in the diversity of its people, and it's important for us to recognize the impact of the virus on our marginalized communities. Governor Reynolds has signed a new proclamation on Wednesday to reopen campgrounds, drive-in movie theaters, tanning facilities, medical spas, and malls are to be open to 50% of its maximum legal occupancy. As we reopen our facilities and businesses, please implement measures to enable social distancing. Businesses continue to encourage flexible work from home and leave policies, considering staggering shifts to reduce worker population at any given time, staggered breaks to reduce staff interactions, review procedures to identify ways to increase the physical separation of staff. Businesses should provide or allow employees to wear their own homemade cloth face mask, and businesses should provide hand sanitizer or hand washing opportunities as frequently as possible. Public health believes that the investment in health is an essential priority for all businesses and communities. Therefore, having a partnership of public health systems and corporations to provide a safe and effective workplace is necessary. Being pro-business also means being pro-protecting the workforce that makes the business thrive. I am pleased today that Tyson Local Management and Corporate is here to speak with you all today. We all know that Tyson employs a unique and diverse range of people in our communities. We have also been encouraged by the steps that have been taken so far to ensure the safety of these employees. As in all things, safety is important and paramount, so ensuring worker health and safety is a continuous process and additional measures may need to be applied. Providing a safe and healthy work environment is not only beneficial to the financial portfolio of a business, but it's a benefit to the community it serves. Lastly, I would like to say this, like most Midwesterners, Iowans are a tough and proud bunch. Well, we will do what Iowans do best and continue to fight COVID-19 as a community. Thank you.
Before I have the pleasure of introducing our first guest, I do have a couple of follow-on comments to Dr. Nafissa's remarks. First of all, per capita, Blackhawk County is the most diverse county in the state of Iowa. And it gives me great pleasure to announce that and to make people aware of that, because it is that ethnic diversity that makes Blackhawk County great. And as the sheriff, I recognize the importance of what I just said. It's that diversity that stands up our local businesses. It's that diversity that makes us unique. And that diversity, we recognize Tyson as a large employer of that population. And so we recognize that when we started asking for that plant to be shut down, we recognized the impact that we were calling for. We started talking almost immediately about the shutdown, but we also started talking almost immediately about trying to stand that plant back up. So this wasn't an I told you so type of moment. This was a measured and kind of a reserved optimism kind of hope that once we were able to close that plant, get it cleaned, cull the herd between the people that had the virus and those that had not, we hope to be able to get this plant stood back up. So standing here today with our corporate partners is a day that we are prideful of. It is with great appreciation and anticipation that we observe and respect the massive work that was done inside of that plant in the short amount of time that our corporate partners at Tyson's did to make that plant able to be stood back up in that short order. We recognize the trickle-down effect and the impact that it had on our local farmers and family farms. We also recognize the impact that it had at the meat counters as well. And so it is important that as we stood as one to try and close the loop and close the gap in our community's defenses, as we recognized the enormous problem that we had with the COVID-19 virus and the amount of spread attributable to the Tyson plant. Now we stand together as one, pridefully saying that a lot of work has gone into being able to stand that plant up as safely as possible. So it is my pleasure to be able to introduce to you the local plant manager of the Tyson operations here in Waterloo, Mr. Tom Hart, who is joining us via Zoom. Tom?
Thanks, Sheriff Thompson. We appreciate the opportunity to be here today. I'd like to start by acknowledging the tremendous efforts of our team members at Tyson and say just how proud I am of you. Your creativity, innovation, and commitment are truly amazing. Thank you so much. I want to assure the public our top priority is the health and safety of our team members, their loved ones, and our community here in Waterloo. This has been an incredibly fast-moving, fluid situation, but there's been one constant throughout the process: our sole focus on using every tool at our disposal to help keep our team members healthy and safe. We've always used the We Care program for our safety, and it's centric to how we make decisions here at Tyson, and that's how we'll continue to make decisions moving forward. I want to thank Dr. Nafissa and the Blackhawk County health officials, Mayor Hart, Sheriff Thompson, UFCW Local 431 for your collaboration and support as we tested team members and took proactive steps to help improve our existing prevention efforts. We last harvested hogs on April 18th, and as you know, on April 22nd, we made the decision to idle the Waterloo plant. During this time, we performed additional deep cleaning, and sanitize the entire facility. We conducted tests for team members for COVID-19, a process that was done on April 26th. All team members returning to work today have been tested, and any team member who tested positive will remain on sick leave until they've satisfied official health requirements for returning to work. Team members who were not tested will be unable to return to work until tested, and all new hires will be tested prior to starting work. We had over 1,000 team members visit the facility yesterday, and those that are returning to work today will see additional changes we've made to promote social distancing and protective measures that meet or exceed existing guidance from CDC and OSHA. Team members are required to undergo a wellness health screening each time they arrive at the facility, checking for symptoms such as coughing and shortness of breath, in addition to using an infrared thermometer to check temperature. We are supplying facial coverings to every team member and requiring that they're worn. This applies to visitors and contractors as well. Additional face coverings and cleaning supplies are being provided to team members that have carpool. And while we've installed additional physical barriers, team members who work in spaces where barriers cannot be physically implemented are required to wear face shields in addition to facial coverings. We've installed additional hand sanitizer locations, have dedicated pathways and visual cues to help space team members in the locker rooms, areas where they obtain equipment, use time clocks, or collect supplies. In addition to our commitment to the physical distancing, dedicated social distance monitors are now stationed throughout our facility and common welfare areas during all shifts to help ensure team members adhere to the safety protocols and the social distancing requirements. These monitors will provide immediate feedback as part of our effort to continually review the protocols that we have in place. As we announced in our press release, we've also partnered with Matrix Medical Network, a provider of mobile clinics, to help provide team members with enhanced on-site care. This includes diagnostic testing for COVID-19, daily clinical screenings, access to nurse practitioners, and employee education and support for personal health goals or concerns. Matrix Medical also performed a full environmental site assessment regarding our mitigation efforts. We believe education is an important part of the efforts that we're doing to best ensure that our team members understand the risk factors so that they can stay safe at work and at home. Our management team will continue to carefully review the protocols we have in place in collaboration with local health officials, CDC, and OSHA. And we'll respond quickly and adapt our policies to any changes in the official guidance. To sum it up, we'll continue to do everything that we can to keep our team members safe and to ensure that the spread is not happening inside our plant and that our team members know how to keep themselves safe at work and at home. We believe these proactive steps that we've taken will help ensure our team members can operate in a safe environment that does not jeopardize their health and well-being. This is an unprecedented time, but let me say again, our first responsibility is the safety and well-being of our team members, and we take this responsibility very, very seriously. Thank you, Sheriff Thompson.
Thank you, Tom. Our next presenter is the president of Tyson's Fresh Meat Division, Tyson Corporate, Mr. Steve Stouffer. Steve, the floor is yours.
Thank you, Sheriff Thompson. I appreciate the opportunity. I want to reach out as well and thank Mayor Hart, as well as Dr. Nafissa, Sheriff Thompson, and UFCW Local 431 President Bob Waters for our opportunity to get together last week as we met to look and decide, are we doing everything that we can to solve and deal with COVID in the community that we live and work in? And quite frankly, as we all know, this is a difficult time, and there's a lot of learning that's being done as we go through, because nobody, myself included, who's been in this business for over 37 years, have ever seen anything like this that we're dealing with. And I want to just take this opportunity to reemphasize what Tom was just saying, and the fact that our focus as we've been going through this entire pandemic issue is keeping our team members safe while we're trying to provide food for the millions of consumers in this country. And it's a fine balance, obviously. And it's important that we remember that running a safe program is what we're all about. Tom mentioned the We Care model, a safety model that we have been developing and maturing with for a number of years now. Wasn't something that just came about because of COVID. It's all centric about us making sure that we maintain our process in control inside of our facilities so that we are running a safe work environment. We will continue to do that. We've been messaging internally for a long time that message to our team members. I have vowed during our conversation last week with your community leaders that I just mentioned that we would work very hard to do better at communicating outside of the walls of our plant throughout our communities. And that is something that I will definitely take to heart. And that's something that we will continue to focus on, because frankly, we not only focus on the safety of our team members while they're at work, but also the communities to which our team members and their families work in. We're all in this business for one thing, and that is to provide for our families. And at the Tyson facilities, we focus on taking care of our team members and taking care of the communities to which their families live in. And we will continue down that path. So I just wanted to say thank you for the opportunity to share. Thank you for the opportunity for us to have Tom speak to what is close to his heart. And we will move forward in collaboration with the local community to make it a stronger place. So, thank you.
Thank you, Steve. Our final presenter today is the president of the UFCW, the United Food and Commercial Workers Union, Local 431, Mr. Bob Waters. Bob?
Reiterate what Steve Stouffer was saying. Is this thing working?
Yes.
So yes. I'd just like to reiterate what Steve Stouffer was saying about working together. It's going to take a community to keep this thing going. The plant right now is germ-free, bug-free. So please, everybody, adhere to the social distancing at home as you would in the plant. The only way we're going to keep these bugs and these viruses out of the plant and out of the food supply is to follow the chain while you're away from work. Thank you, Sheriff Thompson, Dr. Nafissa, and Mayor Hart for attending the meeting on Friday. I think it was a very good meeting. I think as a group, we solved some problems that needed to be solved. And moving forward, I commend Tyson for the actions that they took, because they really impressed me with the changes that they made in the plant. And I've done numerous press conferences, and my message out there is to all the packing plants in the United States: if you want a model to model your plant after, Tyson Waterloo is the model to look after. So I 100% endorse the plant reopening up, and we hope to move forward and be profitable and have safe employees. Thank you very much.
Thank you, Bob. That concludes our prepared remarks, pending your questions.
I don't know if the folks at Tyson might be able to tell us kind of what percentage or what level of capacity they were able to open at today, and maybe what percentage of their workforce was able to return to work?
Tom Hart, would you be able to answer when you do open up? I know you started on the kill side today and you'll open up production side tomorrow. What percentage of operational capacity you'll be running at tomorrow?
Have been off for so long. we're going to operate at a 50% capacity max. And that's not because of the absenteeism. That's just to properly break in our team members from other safety aspects rather than the COVID. We will ramp up production, but since some of these team members have been off for 17, 14 days, we want to make sure we break them into the jobs properly.
Any idea if you're going to be able to get up to back to your 20,000 a day capacity anytime soon, or?
Tom, the question is, do you assume that you're going to be able to get back up to that 20,000 head a day capacity anytime soon?
No, I'd love to be there, but I guess the first and foremost thing is that we take care of our team members. We get a proper break-in, and as long as it takes to get there, we're going to look out for their safety and health first. When it comes, it comes. I can't give you an outlook on that right now. I'd say it would be a ramp-up schedule at least over a couple weeks' time.
Oh, we have a question from Kate Payne. Kate, you're unmuted. Go ahead.
Okay, thank you. So for the Tyson representatives, multiple workers have told us that they were not being notified of who had the virus and who didn't, and that there was virtually no communication, particularly with workers who don't speak English as their primary language. What are you all doing to improve communication with those workers and to communicate who tests positive in the future?
Steve
So I guess
Stouffer?
I'll take that one. It's hard for us to deal with specifics. I mean, as you look at what we do in our facilities, we have a core group of certified interpreters where we work to discuss and have the ability to communicate with our team members. I mean, to speak to specific issues as far as contacts on testing and screening, we've employed companies like Axiom, who has been out there to help us conduct that. I would say that when you're doing massive screenings, where you're talking close to 3,000 people, are there going to be potential for miscommunication and those types of things? I think it doesn't matter whether they speak English or not. I've seen situations like that where everybody spoke the same language and we still had communication issues. So it's hard to address any singular point, but I mean, our focus, and if you go out and see in our facilities, we do a lot of work to try to drive multiple lingual opportunities through our signage and everything else, providing the opportunity for people to see things in their own language, to hear things in their own language, and try to overcome those barriers. And I think we've done a pretty darn good job. Are we perfect? No. I'm not going to sit here and tell you that. But we're going to continue to work to get better at it.
I guess I can speak to that a little bit too, specifically for Waterloo. And sometimes Facebook has something out there before the plant can even react to it. The other thing that we have to keep in mind is we talk to affected team members. Obviously, the person that tested positive, but CDC guidelines of affected team members. The rest of the plant may know that we have a problem, but we're dealing with a lot of barriers that are coming very fast. We make sure that we talk to the affected team members, place them out of the plant, or follow CDC guidelines. But we can't communicate to an entire plant about a person because of confidentiality reasons. And I thought we did a good job of that, explaining that in the very beginning, that if this would come, that there would be we wouldn't want to identify the person.
And also keep in mind, we have Matrix Medical coming on board, and part of their responsibility will be to help us improve this process as well.
And so with Matrix Medical, what will be the process for people getting future testing?
I don't have that protocol in front of me, but what I would ask, if you would reach out to our Fresh Meats communications person, Liz Croston. She can certainly follow up on that question for you.
Are there other questions for today's press conference?
Are you able to give us an update on, we had the last count 2 health facilities that were listed as outbreaks. Is it still 2? And
Yes, it's still 2.
Harmony House and
Friendship Village, yeah.
Kate Payne has a question. Go ahead, Kate.
Thanks, and this is for Tyson folks again. Another of the concerns from worker advocates is the speed of the production line. Has Tyson sped up the line speed during the COVID crisis? And are there plans to decrease that line speed?
So back to my earlier conversation and Tom's earlier conversation around the We Care model. Our team members are empowered to shut off the line anytime that we have a situation where the process is out of control. So if there is a situation, I will tell you that there was no speeding up of the lines. It's a function of how many team members are there, how many of the skilled job sets are in place, and then we have to run according to what our staffing allows us to run. I can tell you that as we were going through this process, what we were doing was slowing down line speed. We were not speeding them up. And so I would tell you that our whole premise is centered around, are we capable of running the plant with a process that's in control that will keep our team members safe? That's the way we came into the COVID pandemic situation, and that's the way we will go out of it, with that same mentality. And if we are not able to maintain a safe and working environment, we will adjust down the line speeds in order to do that.
If there are no other questions, Tim.
yeah, could you kind of weigh in? The governor ordered that, proclaimed that a few additional businesses could open tomorrow, campgrounds and some retail stores that have been shut down for a while. Are you going to be monitoring that from a law enforcement standpoint to make sure that they're doing things they're supposed to?
I think it, so the question is, as things start to open back up, are we going to monitor that? One of the examples given is malls operating at 50% capacity. How on earth do you monitor that? So I think just as much as she trusts Iowans, we trust Black Hawk Countyans. And so I will trust that people understand the seriousness of what we face here in Black Hawk County. They recognize the fact that our numbers are not decreasing yet, that we have not yet seen a plateau, and that they, quite frankly, our numbers in the death category are starting to increase. And so the realities here in Black Hawk County are far different than they are in other places in the state. And so what I would encourage and caution people as some of those restrictions lift, which I get it. It's beautiful out. It's, it's time to start enjoying ourselves again, but please, please, please exercise extreme caution. Use those masks. One of my favorite graphics used in social media by the health department shows 2 people unmasked and the worst possible spread. Then 1 person masked and that spread drops by 50%. And then when both people are masked, the minimum amount of spread. So you don't wear that mask to protect yourself, you wear that mask to protect everyone else. And when everybody is masked, the ability to protect all of us increases dramatically. So when those malls open up and retail stores open up and things of that nature, start thinking about helping us all protect each other. We are our brother's keeper. We are our neighbor's keeper at this point. So the ability to contemplate what you do for others at this point is just as critical. What we don't want to see, and what certainly the governor does not want to see, is the opening up of malls and retail stores and all of a sudden a secondary spike. We certainly do not want to see that. We've been on this meteoric rise for the last 3 weeks. We certainly do not want to see now a secondary spike because of the ability to start relaxing some of these restrictions. So we hope that our citizens exercise huge amounts of caution and certainly reasonable measures to protect themselves, their families, and their neighbors. So as we start to see the lessening of those restrictions, I hope that that is the modicum that of restraint that is used. That masking and washing hands and maintaining that social distance when you're out. Just be cautious of everything that you're doing and be aware of what you're doing when you're out, because we certainly want you to start taking advantage of the opportunity to get out of the house a little bit, even though it's against our better judgment and it's not what we want to encourage. It's contrary to everything that we're seeing in metrics right now for Blackhawk County, but there's nothing we can say or do about it. The next best thing is to say, you kind of feel like that parent of the 18-year-old child as they drive away at night. You say, use your best judgment and be careful. And that's really what we're trying to say right now. Use your best judgment and be careful.
We have a question from Iowa Public Radio, Kate Payne. Kate, you've been unmuted.
Thanks. So we saw a Waterloo employee die before Tyson chose to shut down this plant initially 2 weeks ago. We've since seen 20 more deaths in the county in an outbreak largely linked to the operations there. Why did it take so long for you all to shut down the plant initially? And if we see cases increase again, how will you determine whether to shut down in the future?
I would say that, the conversation really, as we look at how we manage the process, is all centered around making sure we don't create, and the question always was early on, when you're dealing with a pandemic, that means that it is going to be widespread. Our question all along in dealing with the safety of our team members is how do we keep it from being community spread inside the facility? And that's where our focus continues to be. But on top of that, as we are working with our team members and showing them and teaching them about the importance of using masks and using barriers and using social distancing and taking the temperatures and understanding the symptoms and knowing what to look for, and also helping instruct them that when they're not at the facility, the other 16 hours a day that they're not there at work, that these can help them there as well. That's where we apply our focus. So, that's a part of what we do in protecting our team members in the process.
Thank you, Steve. The next question that we have is from Anna Swanson at the New York Times. She says, does the county health department have figures for how many cases and deaths came directly from the plant? And did the county health department observe that the cases at the plant led to community spread?
Okay, so one of the things that it's important to know is that we report reported cases. So our cases are, when I mean reported cases, I'm talking about confirmed case, symptomatic contact to confirmed case, and positive serology cases. So as of right now, in terms of the number of reported cases from 2 p.m. Today related to Tyson is 1,031 reported cases. So again, reported cases, which is different from what the state published of 444, that is of the confirmed PCR cases. But in terms of the scope of the illness, for us reported, we use reported cases to capture the scope of the illness in the county. So for the plan, as of right now, it's 1,031.
Dr. Egbuonye, this is Kate Payne. A follow-up on that. I wasn't clear what the difference is between the state's designation of the 444 and what you're saying with the 1,031. What's the difference there?
So the state is reporting the 444, take it as active cases, right? The PCR, so at the time of testing. But for us to show the scope of the illness, we use the reported cases, which is a combination of the confirmed case, symptomatic contact to confirmed case, and positive serology. And I will have our epidemiologist here also, who's the disease surveillance investigation manager, ask additional questions or respond to additional questions. So Josh, if you want to provide that clarity too.
Hello. Again, my name is Joshua Pecora. I'm the Disease Surveillance and Investigation Manager for the Health Department. So to build off of Nafissa's comments, so the 444 cases reported by the governor were confirmed PCR positive cases done on-site at from the on-site testing at Tyson, and then our numbers, the oh, I forgot to bring that form with me. Our numbers, the 1,031 reported cases, includes those positive test results from the on-site testing, positive test results from local healthcare providers here in Black Hawk County, as well as the positive serology tests that give us the complete picture of scope of illness in our county, which is why we're reporting why we're giving data as reported cases. So. All right, any follow-up questions on the data?
Yeah, just to follow up there, if you can hear me, what were your figures for deaths from the plant specifically, and then did the county health department observe that there was community spread from the plant?
We're continuing to not release any additional data on the deaths other than the age range of death. So we will not be releasing any information on deaths related to a specific employer. And then for the community spread, it's the idea of a case being identified as community spread is that we were not able to link its source back to another known case or a known travel. So by that nature, we can't say that that community spread was caused by a specific case or a specific exposure, because by its nature, it meant that we couldn't identify that exposure. So that's why we said we identified community spread.
Okay, thank you.
And Josh, with those cases, the 1,031, does that include people who are not employees of Tyson, but might be family members or roommates, that sort of thing?
No, the 1,031 is employees.
Okay.
All right, any further questions?
I guess I had a question for the Tyson folks. As far as the changes that you've made, do you have a timeline in place to how long that those changes will be there? Or is this for the foreseeable future as you're running the plan?
Tom Hart, so the changes that you've implemented, do you see this as permanent change, or do you see this as temporary into the near future? How do you qualify the changes that you are seeing at the plant now?
Definitely for the foreseeable future. While this pandemic is upon us, Is, you know, it's hard to answer that question. This is the first time that we've seen it. We've got all these things in place. We're going to leave them in place until we're over COVID, and then we'll need to talk past COVID.
Kate Payne, Iowa Public Radio, you've been unmuted.
To the dog treat factory in Independence. We know that a worker at that factory has died, and he believed that he was infected while at work. Why is a dog treat factory still operating under these conditions?
All right, Tyson Corporate, who would you like to have answer that question? Steve? Hang on just a moment, Steve. We'll unmute you. Steve Stouffer.
So I'll go back to my previous comment. Are we running the plant in processing control, and can it be operated safely? That's outside of my scope. I have not been engaged in that process, but I can assure you, based on Tyson's safety focus, that is the lens that's looked at.
Thank you. Are there any other questions? Seeing none, that will conclude our press briefing for today. Ladies and gentlemen, thank you so much for your attendance. We appreciate it, and we'll see you back on Monday afternoon at 3:30. Have a safe weekend.